Here's what you need to know if you've been prescribed testosterone cypionate. The hormone testosterone is necessary for much of the development and maintenance of many male features. It regulates libido, sperm production, and body and facial hair. It even plays a role in mood, energy, muscle and bone mass, red blood cells, and more. This medication is a testosterone replacement that mimics the natural hormone. It helps bring testosterone in your body up to target levels. This medication may also be used off-label for gender-affirming hormone therapy. Testosterone Cypionate is an injection that, depending on your dose, you take every 2 to 4 weeks. It's injected slowly and deeply into the buttock muscle. Your care team may inject the medication for you, or they'll train you on how to self-inject at home. Since it's injected into the buttocks, it may help to have someone else be trained to help you inject. If you are injecting at home, keep the medication at room temperature. Protect the medication from light by keeping it in the original box. Inspect the vial before injection for any particles or changes in color. If you see crystals, warm up and shake the vial until they redissolve. Side effects you may or may not experience include enlargement of male breasts, acne, and pain at the injection site. Testosterone cypionate does have a risk of misuse, addiction, and dependency. Misuse increases the risk of serious side effects, like heart attack and stroke. It's important to take this medication as prescribed by your care team. Don't be afraid to ask your pharmacist or prescriber about affordability. These days, there are many low-cost ways to get your medication.